My name is Robert Rosenwasser. I'm chairman of the Department of Neurological Surgery, director of the Farber Institute, and medical director of our comprehensive stroke program here at Jefferson. Our experience with telehealth really started about 6 years ago when we implemented it primarily for the treatment of acute ischemic stroke, which is a very time-sensitive disease. And although we are in a metropolitan area, there are many hospitals in a 100-mile radius that do not have the ability to care for acute stroke patients. The Department of Neurological Surgery and the Department of Neurology together provide telehealth to 35 hospitals in the region to deliver treatment of acute ischemic stroke at institutions that did not have neurologists or neurosurgeons on site. The reason we chose telehealth is because no one hospital can have the bandwidth to have enough neurovascular coverage in terms of individual practitioners. And this allows us to reach 1.5 million ER visits in our network and allows us really, in terms of our breadth and depth and redundancy, allows us access and allows the patients access to high-end quaternary care via remote presence. One thing that we have learned is that patients are more compliant and will go to an emergency room closer to their home when they're having symptoms rather than getting in their car and driving into town. So compliance, paying attention to their symptoms has been very rewarding with this medium. I can share with you 6,000 cases that have all been very rewarding because we have been able to treat in excess of 90% of patients with IV TPA when the national average is single-digit percentages. And in addition, 87% of the patients that we treat stay in their own community and do not have to travel. I think telehealth is here to stay and is going to be enlarged in our healthcare system in the United States and beyond. And I think that educating coordinators, educating physicians, educating medical students, educating nurses is all going to be very important in driving this process forward.